like to thank you all for gathering here in the loving memory of Nishant and celebrate Nishant's life. The friends and family coming together to cherish his memories and rejoice the life Nishant had. We all know that Nishant had a kind of cancer called Ewing sarcoma about a year ago. And this is a rare kind of cancer that usually starts in the bones and soft tissues and usually affects teenagers and young adults. And 85% of these cancers are caused by damage to the chromosome, which happens after the birth and for reasons unknown. This cancer which Nishant had can start anywhere in the body, but he had in the pelvis first and then spread to the lungs. And he put up a brave fight, and then cancer got the better of him. He departed, but he left behind as a message saying that cancer is real, cancer is deadly, and if it happened to him, it can happen to anyone. Dear friends, it is a fact that the incidence of cancer is really rising in the world for all the things that we are doing. And it is responsible for about 15% of all human deaths in the world. And there are several factors that cause cancer, and about 10% of these are caused by bad genes, and which we cannot do anything about. But a majority of them are preventable, and they're caused by things we do in our life. About 50 to 60% of all cancers are caused by bad food we eat and drink, and by smoking. And smoking is the #1 cause of lung cancer, and 85% of all the lung cancers occur in smokers, and only 15% occur in non-smokers. And lung cancer is the #1 cause of death in both men and women. Alcohol can cause about 10% of cancers in men and 3% in women. Obviously, women drink less and less frequently. Obesity, which is a growing problem all over the world, can increase the risk of different kind of cancers and may contribute to about 15% of cancer-related deaths. Preservatives and processed food, high excess red meat, they're all cancer risk factors. Another example is high salt intake and eating a lot of barbecue food and fried food can cause stomach cancer. To give you an example, people living in Japan, they basically depend on processed food or preserved food mainly from sea, and their incidence of stomach cancer is about 4 times higher compared to the Western world. But when these people move to US, their risk level or the incidence goes down to the same as people living here. You can see the tremendous effect of food on the cancer. These are only a few examples. There are several others, and in general, the more artificial the food is, higher is the risk of cancer. So what can we do to lower the risk of those preventable cancers? #1, let us all recognize and acknowledge that cancer is real and can be deadly and can be preventable. #2, avoid smoking, or at least minimize smoking. That can reduce the risk of lung cancer. And avoid drinking alcohol, or at least drink moderately. Develop healthy eating habits, like eat more fruits and vegetables, and minimize intake of meat. This is a very difficult thing to do in Dallas because there are a lot of parties and gatherings. And try to avoid preservatives or processed foods. Exercise on a regular basis is not only keeps you lean and fit, but also reduce your other medical risks like hypertension, diabetes, and joint problems. Lastly, there are screening procedures that we can follow to identify the cancer early. There can be unfortunate individuals who, in spite of doing all the right things, may still have cancer, and there are several things they can do to detect the cancer early and can still be a cancer survivor. For example, we need to identify the symptoms early. It is not that easy as said. You're electric. Because every pain or ache or every cold, is not cancer. But if an individual has been healthy all life and suddenly have unexplained symptom like a pain or fever that is not going away, or loss of appetite, or losing weight, or getting tired easily, or have a lump or a swelling anywhere in the body, they should seek medical attention immediately. The second thing they can do is to know your risk. I said 10% of the cancer are caused by bad genes. So if you look around in your family and see there are a lot of family members with different kinds of cancer, that means that you could be also having that bad gene, and you should seek counseling and medical attention immediately. The third thing you can do is, just like we take our cars to mechanics for oil change and servicing, we should take ourselves to our doctors for regular health checkups too. Because a lot of cancers are just diagnosed by routine examination, blood work, and x-rays. And the last thing we can do is screening procedures. We should undergo screening as recommended by the guidelines. For example, mammogram recommended for women over 40 years, detect cancers in a very early stage, and colonoscopy detect pre-cancer and cancer colon in early stage, and tests available for prostate cancer. Now in heavy smokers, there is a low dose CT scan that really detect cancer in early stage and get rid of it. So these are all the things we can do to reduce the risk of those preventable cancer, which constitute about 60%. What Nishant had was a rare kind and was caused by damage to the gene, and he did not do anything to get it. He was only a child, but he fought it very bravely, and he was very hopeful and fought against cancer until his last moments. And he is now an angel and no longer with us, but he left behind an incomplete task, unfinished battle against cancer, and unfulfilled dream to defeat it. So it is our responsibility to take it forward. Nishant Cancer Foundation is a great tool to carry on with his fight and fulfill his dream. And so I would like to request you all to come together and support the foundation strongly, because this battle against cancer cannot be won by hospitals, doctors, and nurses only, but also every one of us has a responsibility and a role to play and a contribution to do. So let us all donate generously and help in any other way to help Nishant Cancer Foundation to continue the fight. And if done so, someday his dream may come true. Thank you.
Thank you, Narotham bhai. Very educational. So before we get the run started, in next 5 minutes, a few things about logistics. The first run we will kick off for adults, and it is a 5K run. And it will start, and you need to go around the lake, and that's 1 kilometer. And then you need to go that side where I'm showing, and it is a two-way path. So you'll go 2 kilometers and all the way under the bridge, and you keep going, and there's a neighborhood on your left, and you're not crossing any roads or anything, but just keep in mind that it feels like you're out of place there just because there's a neighborhood on your left. Just keep going. There are directions there, and also there are orange flags put out all the way on the path. And when you get to the kids' playground, then you need to make a U-turn. And there is a water station over there. You can pick up a bottle of water and come back. Coming back, you have to come back in the same path. So keep in mind, while you're coming back, you might face people who are going the other direction. Just keep that in mind. And after we kick off the adult run, we are going to have a 1K run for the kids from the same place. So we will have someone to guide the kids around the lake, and that will make it 1K. We have water over here, and we have bananas. And after you come back from the run, we have Indian breakfast that we will serve. So we will kick off the run sharp at 8:30. Please gather behind this Please, I think there is a, we will guide you there. Just follow Raghu, he will guide you where the run is going to start from. See you there in a minute.
Wait, we're kids, so doesn't mean
నర్సింగ్ ఇది రన్నింగ్ బ్యాచ్ ఇది నర్సింగ్ బ్యాచ్ ఊరికే భాష
అక్కడ ఎవరు